Good afternoon. This is Dr. John Bennett broadcasting from sunny Miami. Today we have with us here today Dave Spiro, MD, emergency pediatric emergency doctor. Went to school at Yale. Now he's out in Portland. He's the co-founder of ReelDX, and Dave is going to tell us exactly what his project is doing. Of course, medical education as well as other projects. Welcome, Dave.
Hey, John, thank you so much for having me today, and it's a pleasure always to be talking with you about what we're doing here at ReelDX.
Okay, yeah, when I first met you and your team, I don't know if it was strictly medical education, but that's what we focused on. And after I saw your website, I see that you're involved in a couple of things. And I guess a good way to structure it is for you to just go through your website and explain what you're doing. Does that sound good?
That sounds great. I can talk a little bit about both ReelDX education and what we're doing with MedVideo in terms of integrating asynchronous HIPAA-compliant video into a number of different platforms. But let me start off with how we started off, if that's okay, and we can just continue the conversation.
Okay.
Let me share my screen.
Oh, got the wrong screen. There you go. There you go. Transforming medical education.
Great. So ReelDX education and the company ReelDX was born out of this, which is essentially the idea that we can scale secure video with patient consent as a way to teach the next generation of medical doctors, nurses, paramedics. And really the key part to the story is that real patients are the most powerful teachers in medical education. And I think somewhere along the way, 20, 30 years ago, and I was certainly caught up on it when I was on faculty at Yale, got caught up with PowerPoints and technology. But ultimately, real patients are our most powerful teachers. And I'm sure, John, you can remember many, many, many cases when you were in the early, mid, and latter part of your clinical career where patients taught you things. They shaped you, didn't they, John?
Yes, they did.
So essentially, we have partnered with a number of different groups, and our platform is HIPAA compliant. And what that means is the technology behind the scenes is HIPAA compliant, and we have 3 parts to our consent form, which is maybe the most important part of ReelDX education is the consent. The consent is a HIPAA waiver. So patients sign a waiver because the video is identifiable information. Patients sign a consent to put the video on our website, and then patients always have the right, John, to take the video and have it destroyed at any time, to take it off our website and have it destroyed. So there are 3 parts to the consent process, which is very, very important. At this time in December of 2015, we have almost 700 cases sourced from the US and around the world, covering over 1,000 topics. Our libraries span from emergency medicine to pediatrics to eating disorders to neurology, which is sourced at New York University. It's captured by all different specialists and providers, from medical doctors, clinicians, nurse practitioners, paramedics within the field, and colleagues from around the world who are actually consenting patients, capturing a 1 or 2 minute video which has a teaching point or 2, and then we're curating it and putting it on the site. And I'll show you what the cases look like. And all the cases are peer reviewed, and we have a very experienced board on various specialties that help us review the cases. Getting to what this is, it's a unique teaching tool. We now have 22 institutions, from medical schools, nursing schools, and EMS educators at colleges to even a high school teacher and his faculty in health class in Colorado, that are using the cases. And how are they using it? They're using it in all sorts of different ways. They're using it in lectures, they're using it in presentations as a discussion, they're using it to start off a simulation, they're using it in flipped classroom where they're assigning cases and discussing it later on in the day or the next day. And students are using it as a self-guided tool now that we have 600 cases as a supplemental learning resource as they go through their clinical rotations. We have a number of free videos on our site to access, and some success stories from various places such as Vanderbilt University and other programs that are using our site. I think at this point, John, let's take a look at one of the cases. So this is an interesting case. This is a 17-year-old male with dyspnea after sustaining chest wall trauma. And I'm not going to play the video because the video does not go well, or I can play a little bit of it. So let's see what the video, let's see if it'll play Google Hangout.
All right, buddy, so can you tell me what happened today? I was racing bicycles, and myself and another rider got together, and I crashed and basically just impacted on the left side there. And initially, when I wrecked, it didn't knock the...
John, can you hear that video and see it?
Yes, we can. Yes, we can.
Oh, that's awesome. So essentially, the video is a 1 or 2 minute interaction between the physician and the patient. Oftentimes, the video content has supplemental material such as an ultrasound, and in this case, the ultrasound shows the fact that this child indeed has a pneumothorax. So this is a very interesting new way to diagnose a pneumothorax than in a radiograph. And in this case, the ultrasound actually found it, and the radiograph did not find it.
That's a portable ultrasound, correct?
Portable ultrasound at the bedside in the emergency department, and this was shot at Louisville Kosare Children's Hospital in Kentucky.
I'm sorry, that's a common thing now for busy ERs to have ultrasound portable. The doctors have them in their lab coats?
Not in their lab coats. They're portable machines. You can hand carry them, or they're on carts. But all new residents in emergency medicine are trained to probably source and diagnose 15 or 20 standard conditions in the sense of using ultrasound technology.
Oh, good. Okay.
The way the case works is that we have vital signs here. The child was on a 99% room air, saturation with a non-rebreather mask, not on room air. We don't have a report of what his sats were on room air. They may have been using a non-rebreather as part of his therapy. His heart rate was 69, respiratory rate 15, clearly in no respiratory distress, and he was an otherwise healthy child. And excuse me, the way the case is set up is there's a differential diagnosis and a patient workup that talks a little bit about what actually happened and an ability to reveal the diagnosis. Here it's pneumothorax. The treatment was 100% oxygen to wash out the nitrogen, and the patient was disposed. And essentially, almost all of our cases have suggested references as well, and a brief part of curation. In this case, the curation was a little bit about the ultrasound and what it meant in this particular case. The goal is to establish 1 or 2 or possibly 3 teaching points, and then moving on. Do you have any thoughts about that, John?
No, that's okay.
So that's a way, essentially, the cases are viewed out, and we are fortunate to have a wonderful content management system built by our technology team. And the way behind the scenes this is available is the libraries are sorted out by specialty. So we have now pediatrics, emergency medicine, EMS, significant number of EMS videos sourced from the field, a nice growing developing world library, an ultrasound library, a rare disorders library, and a neurology library. We're soon to launch surgery, We're soon to launch an eating disorders library, which is going to be fascinating because it's really a combination of chronic medical issues and psychiatric and psychologic health in terms of eating disorders. And we're actually going to be publishing, I believe, our first case today. It was just peer-reviewed this morning. And the way it works is that you essentially enter a search term. So if you want to learn more about thoracentesis, you can type that in, and up comes thoracentesis, and you can be ready to go and play the case. Do you have any questions about that?
Well,
Does that make sense?
Yeah. Could you comment? This has grown since the first time I interviewed you guys. How many universities use it now, and how many medical schools or whatever? Do you have many affiliations now?
We do. We have about 7,000 individual subscribers, and we have now close to 22 institutions. That's over 6 months. We have close to 22 institutions signed up. Some of them are medical schools. Some of them are nursing schools, EMS institutions. So we're incredibly excited about that, and we're growing every day. We get requests for demos and engagements around that, and the way institutions are using it is also growing. We actually thought about 1 or 2 different ways to present this, but can you see this document called 5 Ways to Use ReelDX Education?
Yes.
So the way educators are using it, they're using it as a lecture-based learning tool where cases are being integrated at some point in the middle of a PowerPoint presentation or other LMS platform. It's being used as an asynchronous learning tool, so cases asked to be reviewed the night before and then presented. It's being used as an unknown case where a case is being presented, and in that regard, another way to use it is for students to be able to practice their presentations. How do you summarize a case from the beginning? It's being used to start a simulation as a way to improve the suspension of disbelief. And it's being used as a self-guided learning tool later on. So there are a number of different ways that it's being used. And now at this point, it has grown, John. We have over 1,000 topics. And this is available on our site as well. It's often used less by the students and more by faculty who have access to a topics list and can find different topics much more easily than going through the search functionality as well. Although what's cool about this is that once you have a case as a faculty member and you're looking it up, oftentimes there are related cases that might help a faculty member determine if it is indeed a case they want to present in addition to the one case that they found for their talk or their time that they're spending with the students. So this has definitely grown. The other part that is definitely grown for us has been the idea of our MedVideo platform. Our MedVideo platform grew out of ReelDX Education. So when we were starting to publish video cases back when we were talking, John, we were approached by significant parts of industry, such as drug companies, very large pharmacy companies, asking about our HIPAA compliant platform, and can we use what we call asynchronous video, which is video that's viewed like on YouTube whenever you want it, is a way to improve healthcare. And so we built out our platform to be extremely HIPAA compliant. When I mean extreme, that means every bit of data from the upload, storage, and sharing of it is locked down. And essentially, MedVideo is a unique new tool that we now have over 170 companies in our developer program, and we're about to turn on the switch to allow it to be freeform, essentially a freeform ecosystem. And what MedVideo does is does everything. It does encoding, transcoding, streaming, and allows an identity integration to allow asynchronous video to be employed for a number of different use cases for healthcare. And we see now ReelDX education as just one use case of many of essentially using asynchronous video to improve healthcare. So that's a bit of a nutshell of what's happening. We're really, really excited about where we're headed, both in terms of the deep part of how we're involved in ReelDX education and then our MedVideo platform. I guess the last thing I'll say is that we have a number of cool partners who we're working with, not only who are subscribing and sourcing video, but John, we have a number of different partners like Insight Med, which is a file sharing program in the Spanish world, both Spain, Central, and South America, and they have an app around file sharing where physicians share x-rays that are anonymized, and they're going to be launching a premium product with ReelDX videos, as well as CPDME and Clarity and some other strategic partners in EMS world that we see to be using our platform in a way to improve education for the new generation of healthcare providers. So that's just a bit of a walkthrough. I'm sorry about the, let me get off of this.
Yeah, there you go.
That's a little bit of a walkthrough of what we're doing, and happy to answer any questions.
Yeah, just a comment on HIPAA. What is HIPAA? Some people may not even know. Of course, most doctors know what it is, but I think the law is that if there's any information about a patient or the patient seen on the video, they have to give their permission for, even if they're not the main person in the video. Every person in that video has to give their express permission for that video to be used.
That's correct. So there is something called PHI, or Protected Health Information, and Protected Health Information video is something that's protected because it's identifiable. And we have two aspects of that. One is that for ReelDX education, where we're publishing real patient video, patients sign a HIPAA waiver that intentionally, through the consent process, allows them to, gives us permission to publish that video. We actually don't publish any other identifiable information, so patient name, patient MR numbers, medical record numbers, so there's no other identifiable information outside of the video. And then, as well as I mentioned earlier, I think the consent process for ReelDX education is the most important part of ReelDX education, which is the consent, make sure that the HIPAA is signed and that patients give their permission to put the video on our site, as well as patients always have the right to take the video off the site.
Now, if you show a patient's body part, I was talking to an ankle surgeon from Duke, and he said he couldn't use a picture of the patient's ankle, even though you couldn't identify the patient's face. It was just an ankle. Is that true? Even if you use a body part and you really can't identify it, you can't use that? Is that true?
Well, you might not be able to identify that patient's ankle, but the patient might be able to identify his or her own ankle.
Okay.
And that's enough. So there needs to be permission. And what's interesting about that, and that's why there are 170 companies involved in MedVideo at this point, is that doctors all over the US and nurses and ancillary staff are violating HIPAA every day, and it makes hospital administrators extremely anxious.
Right.
So the most common way that HIPAA is violated is this.
Oh, really? By taking pictures in the hospital? Okay.
Yeah. So patients. So I'm a urologist. I've gone home and patients in post-op, and the nurse has a question, and she FaceTimes me. FaceTiming is not HIPAA compliant. You know, or doing something like this.
Right.
not HIPAA compliant, or texting patient information or taking a picture. I can't tell you how many times paramedics in a trauma scene come up to me in the emergency department. They shoot a video or they shoot a picture, which they're not allowed to do on their smartphones. And I'm sitting in the trauma bay and the paramedic goes, "Dr. Spiro, can you come here?"
Yeah.
And we go to the corner of the trauma bay, and secretly he shows me his phone. He says, "By the way, this is where the patient was extricated. And by the way, that's very important for me because I'm trying to figure out what tests to order for the child, and seeing the scene can often be very important for the trauma or emergency physician, yet it's illegal."
Right. Well, but there's no prosecution of things like that, obviously. There's just too much of that going on.
There's some, I wouldn't say prosecution, but
Well,
hospitals.
warning.
Well, hospitals are, if hospitals are found to be outside of compliance, they're fined.
Right.
They can be fined actually quite a bit of money. And I've known of healthcare professionals that have been fired from their job because they were trying to do the right thing to improve patient care using technology that's available, but they can't use it. And so what MedVideo does is our technology makes it safe.
Very good. Well, Dave, thank you for coming out again and letting us know the expanded use of ReelDX and its growth. And we'll continue to follow along. Thank you very much.
Thank you for allowing me to be on this program today. It's an honor.
Thanks, Dave. I'll see you. Good night.